Hey everyone, this is Chris from Affinity Home Care, and I wanted to go over our private duty home care guidelines that we have. And this is the scope of care that we have as a set standard, and also what we go by our policies and what we commit ourselves to our client when we're going out to do a care assessment with them, and we're letting them know what the type of care that we provide for them and the type of professionals that we're hiring to make sure that they understand what what our employees are trained for. So that way it's matched up when they go out and do an assessment, and also our caregivers, when we do hire them, they have the right skill sets. So they always are feeling comfortable. So let's get started. I want to go over, we're going to concentrate on what private duty home care guidelines are important. And these are specifically to gauge that are towards activities of daily living. They are important to understand here is that activities of daily living are the type of uh, care that you are providing in the home that the client, some of these services they can do and some of these services they can't do. So it's understand is that you and I are so fortunate, and our family members or anybody that we have surrounded by us, we are blessed to be able to wake up every single day and be able to take care of ourselves and be independent, get dressed, shower, eat, have make our own meal, go to work, come back home, hug and kiss and love your kids and your family and your wife, and to walk around the neighborhood or do so many type of any type of physical activities. And just remember, this is all a blessing. But activities of daily living for our aging population and our clients, one of these scope of care guidelines that I'm going to go over with you is what they're lacking and that they can't do. So we're there to fulfill their quality of life, to make sure that they receive a good quality day or shift that you're there and you're keeping them safe. So that way, one side is that their family has peace of mind, and also too is their own spouse could have peace of mind, so they know that they are in their place. And we call that aging in place. Aging in wherever it's going to be their home or the facility that you're in, that they're there and that they're going to be there safe. And if that's going to be their last place of their until end of life, is that they are in the best place possible in the most safe environment. And where you can go, I'm going to go ahead and just I share the screen over here with you guys, and you can go to our website, affinityhomecareagency.com, and under services, you can always find our scope of care guidelines. Okay, and this is where you would go down to private duty and scroll down where it says home care guidelines. Okay, and our home care guidelines, I want to first start by talking about the physical activity with you engaging with your clients. Transferring your clients who can bear weight on legs is going to be very important. When they're assisting, walking with them, going out to the park or going to the doctor's appointments, whatsoever, is that part of your responsibilities being in the home is that you are transferring them, but also too is they're able to be able to walk on their feet. Okay, and so if they are, we want to promote them to be able to have physical activity during your shift. Physical occupational therapy can be in there as well too on our home health care side. If you're there when the physical therapist or OT is there, you want to use that time wisely and to ask them what is it that we need to do when they leave. So care pros can give clients reminders to complex exercises and standby assist with them when doing these balancing therapy and techniques. So it's always good to remember exactly what the PT and the OT is doing. Our family members, what we always tell them is that when they're done, that we continue those exercises. So physical activities are going to be so important. Lifting and transferring. Transferring your client who can walk on bare legs, okay? There's a big difference between if they can not bear weight or they can bear weight. So we always assess if they're going to be able to, if we are lifting and transferring our client and assisting with their walkings and their outings when they're out and about too as well. So if that's you're helping them get out of the car to get to their doctor's appointment, you're helping them to get to that point, A and B. Or if you're going to help them get out of their car into their wheelchair, that's another type of transfer. And then another example of another type of transfer you're going to be helping your clients always watching out for is when they get out of bed. From out of bed to the wheelchair, or from the wheelchair to the toilet, or from the wheelchair to the commode, or from the toilet to the wheelchair, or from the wheelchair to the shower chair, from the shower chair back to the wheelchair. And these are type of, or from the kitchen chair back onto the wheelchair, these are all different type of lifting and transferring that we expect our care professionals to always have, and be able to be confident when they're in the home. Now, when the physical and occupational therapist is there too, is that completing the exercises and helping the therapist that while they're there to help standby assist and help with the balance of your client as well too. So there's different type of lifting and transferring classifications that we have, and there are three. One is lift, or a light transfer. Two, a medium transfer. And three, a high transfer. So when we go in and do an assessment, I'm going to make sure that you understand if this is going to be a light transfer, you just have to stand by assist. Versus a medium transfer, it's more of a partial assist, okay, but still a fall risk. And then a high transfer, we're going to be classifying that as a full assist, and you most likely, a client usually is bedbound, or they need a Hoyer lift or a sit to stand, and this is something that you would understand, you would know prior to going into the client's home. For non-weight bearing clients, so for clients that are non-weight bearing, they can't walk at all, and they're bedbound, lifting and transferring, typically we're using sideboards, Hoyer lifts, and a sit-to-stand lift. This is considered a two-person transfer, and we always ask what the weight is of the client. So you're going to be able to always see the weight of your client, so you can understand. We always assess that if there needs to be a two-person lift, and then we always will let you know if there's another family member to help you with that. And if not, then we have to see what type of medical devices are in the home. Next is companionship. Companionship is so important. Having conversations with your client is going to be the most important part of your job, is communicating with them, building a relationship, asking them what their activities are they like to do. A lot of our aging population, seniors and our clients do not like to do much, but whatever it is that they like to do, you do it. It's for example, watching TV. If that's what they love to do, watch TV with them. Enjoy whatever, find out what channel they like. I want to put the channel on that you like, because they might not have any interest in that. And then also attending any type of functions. It's good to have them involved with their neighbors and their friends and their family if they want to. But if they don't, you don't want to force that. But if they have any family or friends that are having events and they call them and try to invite them over, or if you can try to promote them to go see their grandchildren or their children or their neighbors, I really think that you should try to do that and add that towards your day. And then supporting their hobbies as well too. If they like to knit, if they like to go out and clean and do type of landscaping, you stand by assist. Of course, that could be a little risky, but at the same time, if that's what they like to do, they like to go sit on their deck and have a little coffee. They like to go get the mail and go with them and walk outside and go up and down the driveway a couple times and get some physical activities in. What is it that their hobbies are that they like to do? And ask them. And these are the questions that we typically ask during an assessment too, so that way you can understand and you can offer that without even before you go into the client's home, of course. Meals and groceries is another type of scope of care that we do. We prepare meals and help cook the meals as well too. We try to stick to simple recipes that are in the home that the family members can give us and they can instruct us with and leave instructions with, or we can also create our own. We can go online, and just look up some meal that they agree to have and assist with them. And you guys can do it together. Cooking is a great activity to do during the day together. It's just that be mindful that if they're standing up in the kitchen, they might have to sit in the wheelchair and guide you too as well too, because standing could be a risk for them too. Assisting with eating. Some of our clients can eat on their own or they can't eat on their own, and just understand that that's part of the scope of care guidelines that we provide, is that you always make sure to see how your client is eating if they need assistance. And it doesn't matter what type of status it is whatsoever, feeding your client is so important. And understanding, one tip that I always tell a lot of family members, or a lot of our care pros, is that, and family members as well too, is that offer to eat. Always offer. If your client's always going to say no, it's just, then they're not going to eat. But by you making a sandwich and say, hey, I'm going to make you a turkey sandwich, not asking them, you're telling them you're going to make them a turkey sandwich. A lot of care professionals always say they decline to eat. Yeah, they're going to decline to eat because a lot of Asian population don't have a big appetite like how we do. As time goes on, they just and it's not. And we know that that's not healthy. So having one bite of that turkey sandwich is so important. It really is, much better than having zero. And you can put that half that turkey sandwich, you put it in the refrigerator, and you can offer it in the next like couple hours too. Okay, you'll be amazed how often you offer, and the more you just make something, they'll eat. And a lot of our clients also too is they feel like that you are obligating them. They feel that they don't want to bother you. And that's not why they have us in there. And you have to understand that too as well while you're in the home, is that it is important for them to have proper nutrition. And so some of your clients might also have situations where they can't chew or swallow, and then they have chewing impediments, and they need specific type of guidance on how to feed them. And prepping them is going to be important when we do that care assessment, or when we talk to our family members as well too, and then they can give us instructions. But most likely before you even start your care, we're going to know exactly about their chewing or swallowing limitations, and then we're going to make sure that we alter that based off of the instructions that we give. And then specialty diets will be explained to you before, and as time goes on too as well, you get to know them, what they like, and you can alter it. Knowing their allergies will be something on your care plan. You'll know if they do have any type of allergies whatsoever to food or also to medications. Next is personal care. Personal care is assistance with personal hygiene, okay, and helping your client with their grooming and their hygiene, and it goes along with changing their briefs and their pads and bathing them and showering them. Now, bathing can be classified as sponge bathing, or you in the bed, or you could sponge bathe also with your client if they can be able to stand up and hold on to a certain surface area that is safe, and you can also wipe them up and down too as well too while they're standing. Okay, and there's also devices that you can use as a sit to stand device too. You can also wipe and clean your client up too as well. And if they have a Hoyer lift is another option. It's not advisable. It could be a hot mess, but it also allows you to lift them up in the air, clean the linens up, clean their legs up in any type of area whatsoever. But of course, if you're going to use the Hoyer lift, you have to change the whole pad and throw it in the wash before your shift is done. You have to take it out and make sure that it's clean and dried, ready to go for the next caregiver for the next shift. Emptying colostomy bags. There's colostomy bags that have bowel, and all the scope of care that we are providing for is that we empty them. Okay, and that's it. We drain catheter bags and empty catheter bags. That is it. We don't mess with anything else whatsoever. If there is, that is more of a registered nurse that needs to be involved with them, or you call the office. We have registered nurses here to advise you and guide you in the right direction with that, but that is not in our scope of care to be able to alter or change anything regarding the skin area of the colostomy or the catheter bag or insertions of it whatsoever. We're there to drain the colostomy bag and also to drain the catheter bag. And grooming, wanted to go over that with you, is that it consists of one, oral care, is making sure your client brushes their teeth during the day, in the morning, and at night if you'd like. You have to be careful. Sometimes twice a day could be too sensitive on their gums. You don't want any type of bleeding whatsoever. But also too is you have to be careful. They could be on blood thinners or they could be diabetic. So any type of bleeding is important. So brushing their teeth. Be careful with that and on how hard you actually put pressure onto their teeth. Or they also have dentures. Dentures is also another. Your client will have to take them out, and you will have to wash them and clean them for them. So this sanitary. If you talk to a dentist, how important it is to have your mouth healthy and clean, and that it can cause much more problems. And it's a direct access to your brain, into the bloodstream. So if our aging population is not taking care of their teeth, and especially their dentures, what's happening is that they're eating food, they're putting their dentures and not cleaning it, and bacteria could build up, and that can go into their bloodstream. That can cause a big problem. Using electric shavers and shaving your clients is important. If you see them growing a beard, or if you notice that it's getting a little long, that's a great activity to do during the day, or when it's time to shower, when it's shower time. And so electric shavers is part of our scope of care. We can help them with that too. And then assisting with their dressing, helping them get dressed, giving them options. There's a whole nother series of discussion about dementia care and Alzheimer's care, memory loss, when doing dressing, and what to do and what to offer your client, and how to keep them involved and keep them happy, and then keep them dressed too. And nail filing is also a part of the scope of care of our personal care. So check your client's nails. It's so important to be able to file their nails, their feet and their hands. Okay, and be careful though too if they're diabetic and also if they have they're on a low blood thinner medication. Is that you don't want to cause any type of bleeding, and so cutting the nails is important. But if you see that they have thick nails, that's called inocogryphosis, and I know that is called thickening of the nails. Um, Typically, you should have a podiatrist or professional come into the home. That's something you can call the office. I know that my father, he's a podiatrist. You can call him, or we can call, if it depending on the location, another podiatrist to come out there and visit the client at the home and clip the toenails. And this is something that a professional should do, not a caregiver. Emptying, then applying and changing condom catheters. If the client has a condom catheter, make sure that the scope of care is that we're just changing it. So that's all we're doing is just we would change that type of catheter. And then always understanding during personal care what type of devices you have in the home to keep you successful. If you don't have the right devices, you call the office. We talk to the family members, we get it there. Okay, we can easily get an Amazon shipment right away, real quick, and prime the right equipment into the home. If it's a vital situation where the family members can't afford it, we'll try to help them as much as possible. But doing personal care is all about also too having the right supplies, all the bed pads, all the briefs, the wipes, the linens, having a walker, a wheelchair, a Hoyer lift, a sit-to stand, a gate belt. These are all assistive devices that are going to be very important to help you, and also a shower head. These are things that when we go into the home and do an assessment, we're going to make sure that you have a shower head, but most importantly, is it a removable shower head? A removable shower head allows you to clean the client up and down and all around, especially when they're sitting in the shower chair. You can clean up in all different angles, okay? Instead of having the shower head just go directly on the area, and then you have to move the shower head. It's just too much work. We always ask for the removable shower head, and always, if you need that to be installed, you call the office. We have handymen to be able to help you with that. That's another topic about resources that we have, but that's something that we can do for the family members to get that going. And also grab bars is another thing where we look for too. Grab bars are going to be very important because your client can stand up in the shower. If they can, it's really good to use the removable shower head to clean their private areas too, while they're standing up and holding on to the grab bars. The grab bars is essential because they can stand up, and we could be able to get all those hard areas to be able to clean up real quick. Next in our scope of care is wound care. Wound care is something that we can do as caregivers, but there's the scope of care where there's a fine line where a registered nurse should be stepping in. And if you do need a registered nurse, we are licensed medical home health care member, so we can have a registered nurse here upon the doctor getting an order, submitting that to the office so they can help you. But minor cuts and scrapes, and we use that with soap and water. So if there's any type of minor cuts and scrapes, we can do that. We can remove any type of dry gauze or any unopened skin. That's something that we can do. Applying barrier creams and lotions on the skin and following the instructions of what we are given on the care plan. And if there's any type of secure bandages that need to be secured, we can be able to do that too. But if you see anything else that is outside of the cuts and the scrapes and helping with putting any lotions or dry gauze on your client's home, if you see any redness or any type of drainage, you need to call the office. Let us know. It could be something more serious. So protect your client. Call the office. Let us know exactly what's going on. Report that. Second is light housekeeping. Light housekeeping is part of our scope of care. It is so important. A lot of our family members always ask about the light housekeeping, and you already know that some of our clients too want it, but they could take advantage of the situation of what light housekeeping means. Light housekeeping includes in our scope of care that we can do, and you always let your client know that we can do, is cleaning the dishes, helping with the laundry, tidying up the rooms, removing the trash, and cleaning the counters. Now this entails the light housekeeping entails where we're providing care. If we're not providing care on the third level of the home, there's no reason for us to be able to clean up any type of counters up there or tidying up any type of rooms. Now, I know that you're going to build a relationship with your client. It's so important. That's what we want. I'm not going to tell you not to do anything in the home. You're going to want to go above and beyond because customer service is number one. That's what makes us who we are. So always remember, if you want to do those things and you have time and you have this downtime, then so be it. We want you to build a relationship with your client, but at the same time, sometimes there is another level of housekeeping. It's called deep housekeeping. Getting on your hands and your knees and cleaning and mopping. That's something that we don't do. Okay. So we don't do the on your hands and your knees in multiple rooms and dusting and cleaning in rooms that we're not even in. These are and then maybe the daughter or the son that lives there, they want you to start doing their laundry. These are things that you just have to call the office and report it. Now, again, if you want to go above and beyond and help the family members, we're not going to say no to that. But always do remember that we don't want you to be taken advantage of as well too in the home, and we want our clients to be able to stick to the scope of care that we tell them initially. So that way we set a set standard guideline so everybody's on the same page. Transportation, another scope of care that we can do. We can provide our clients with transportation, and we can go to doctor appointments, PT and OT rehabilitation centers, going to get groceries with your client, running errands with your client, and any type of errands that they like to do. And then again, social events, any family or friends or things that they have going on, is to promote them. And we could take them. We can drive in your car as the care professionals or their car. And remember, the Care Pro, we can transport our clients, but remember, are they bearing weight? We have to ask themselves that. Can they walk on 2 feet? Do they need a wheelchair? When you're going out and running these errands, do you have the wheelchair with you? Can the car fit the wheelchair? Make these decisions before you even decide to say you can commit to doing transportation, so that way we can understand that. But also, too, is we need to know that if it's going to be, whether it's going to be your car, if it is going to be your car, you have to have an updated auto insurance and registration and driver's license, okay? And if you don't, then you shouldn't be doing any type of transportation whatsoever, or you could drive their car, okay? And this is something that you can address in the office and let us know if that comes about where you don't have an updated auto insurance or whatsoever. Most of the time in our office, we already know that you do, so you're not going to be providing any type of transportation at all. We ask you to have reliable transportation, make sure that you can get to the client's home. But rideshare is also a part of the transportation where we can get you to the client's home that we offer. And that means that we can get you a Lyft or an Uber to help you with your transportation to get you to the client's home. But that's it. You don't provide any type of transportation at all with the client. You don't order an Uber with the client or a Lyft whatsoever. We have to have a good understanding with the family members and the clients is that if you're not able to do any type of transportation, then the only option is that they can use the client's car. And that's if they agree. Next is medication reminders. Medication reminders is a big topic, and I'm just going to go over with it to you. I'm probably going to have another video about medication reminders, but I'm going to briefly go over it with you. That is something that we can do. When we go out and doing the assessment, you're going to know where the medications are, what room it's in, what pharmacy are they using, do they have a pill organizer, are they using a blister pack. Now, we are self-administering medications, and that is okay. And we call that using the guided hand technique. And this is something that I'll go over into more detail again with you, but I'll briefly go over that. Understand is that your client who cannot put their medications into their mouth is something that you're going to know before you start care, and we're going to provide you with instructions. And it's important to understand the guided hand technique, because a lot of our clients who do have dementia and can't remember to take their medications and put it in their mouth, there is a way that we can get to the point where point A and point B to make sure your client does get their medications. And there's a lot of other options. For example, crushing their meds and putting in the applesauce. That's just one tip right there. All oral medications need to be prepped and placed into a MediSet bubble pack. This is something the family member gets from the pharmacy, and then it is properly labeled with the date and the time. And it tells you when the due time of when you to help and give the client, hand guide them to deliver it, to make sure that they take it. And then only single MediSets are allowed out of out for reminders at a given time. So if they have AM, PM, and afternoon, don't confuse the client. Keep the AM out there for when your AM shift. When your AM is done, move it to a different location. Have the afternoon ready. After the afternoon, put that away, put the bedtime and the dinner time. So that way the Medipacks are just what it is at that time. So that way it doesn't have any type of confusion whatsoever. Okay. Now, the care pros can use the hand-guided technique with oral liquid medications, but the client must be strong enough to push the plunger to dispense the medication independently. All liquid medications need to be pre-measured. Okay, and this is something that can be done with a registered nurse, or two is also with the family members. But we can guide them to the put it oral medications, and then we can show them and assist them and talk them through to push the plunger on their own with you and your hand on them together. The following applies for as needed medications as well too. Medication patches, another scope of care that we can. So if the client does have medication patches, that is something that we can assist in opening the packages and applying it through the hand-guided technique. Medical marijuana, same as medications, where if it's legal, we need to have legal documentation. We need to have medical marijuana cards. We need documentation. We need to understand medical necessity. Oxygen, you may replace oxygen nasal cannulas or the mask for the clients from the face when they have them on. And then CPAP breathing machines are okay to be able to manage. You could turn them on and off and help them with that when you're there on the ship. And then vital measurements. You can assist your client with self-measurement of the vitals and on electronic machines, or you can record the results as well too if the family members have a type of daily log that they ask for and what they to have. We do provide facility care, so we do sometimes we'll have clients that are in assisted livings or memory care units or foster homes or whatsoever. I would say 99% of our clients are in the home. So, but we can provide care in hospitals, skilled nursing facilities. Generally, these are sitting services, and personal care support is based on usually the medical facilities, and they are the ones that go adhere by the policy of what needs to be done with hands-on assistance personal care. We're there to do sitter services. Sitter services is typically that we're doing companionship services. It's part of the care plan that we would give to you, that you know exactly what the expectations are. But you really need to understand of like what facility it is, what the door of entry it is, when your shift is. It could be at night. Do you have a code? Is there a code to get in? What room number to go in? And it's important to have also the manager here in the office too to go with you on your first shift to understand what the guidelines are too as well too. One is I wanted to say about the facility care is that always show respect. Never stoop to anyone's level. There's a lot of gossip in facility care. We want to always, one is that we want to have our dress as uniform. We want to dress professional at all times, and also respect all the staff that's in the facility. If there's any issues or concerns whatsoever, okay, you address that to the office, and that's it. You should have no confrontation at all with any type of employees or whatsoever. If you feel like there is something that they feel that they are trying to start or try to cause any type of conflict, I would refrain from saying less. Less is better than saying more. And just always remember to call your management team and call your office and discuss it. So maybe we could talk it over with you, okay? But always be the bigger person, always. Remember, we have a reputation to uphold. We want to be classy, compassionate, professional caregivers in the facility care. We don't want to ever lash out on any type of manager or anybody in the facility care. And another thing I want to tap into is that no sleeping. No sleeping whatsoever on your shift, especially at a facility care. If you're there for a 12-hour shift, it's important to understand that there's no sleeping on your shift at all. And taking breaks, there are Michigan guidelines that we can go over about taking breaks and whatsoever, but leaving your client unattended could cause a case manager, a nurse, or a therapist in the facility to report you to say that you aren't with your client. Be aware of that. If you have to step away, it's best that you call the office, let us know what's going on, so that way there's no he said, she said situations, and build a relationship with the team that's there, that's working, the managers there, and try to strive on that, because they're going to be more apt to understanding where you're coming from, and be compassionate and caring, and letting them know that you're there to help them too, okay? Sometimes they might need your help. It's okay, okay? Just think of it if it was your mom and your dad, and you were there visiting them, and there was a caregiver there, and the caregiver just needed an extra assistance. And can you imagine that someone at the facility declined them? Just always remember that having a helping hand is going to be so important. It will take you far in facility care and all the other employees that you're working with. Dementia care, we'll go into deep and dive into that. And there's several umbrellas of topics to discuss. So I will have a whole series on different type of dementia care. There's 6 type of dementias. Just always remember. Then there's mild, moderate, and severe cognitive impairment. Okay. So remember, there's 6 type of dementias. Okay, not just one. The most common is Alzheimer's disease. I'm a certified dementia practitioner. I'm gonna give you the best I can of education possible with dementia. But if you have any questions or concerns about your dementia clients, you call the office. I'm going to help you redirect you to make sure that you're going to stay in that shift and be happy and in a good environment, so that way you can continue with the same client, but know how to handle the behaviors, okay? And know how to redirect your client, be able to make sure that that they are know that they have and family members know that you have a committed caregiver that's going to be able to provide them with the best care possible and understand dementia and their family members' behaviors, and that you're going to be the expert to be able to provide that for them. And then unsafe environment is another, which hides into hoarding of a client. If we are going into a home, we see like there's an unsafe environment, we're not going to have you go in. Okay, we do these assessments way prior to before starting our client's home. If we feel that there's some type of environment that's going to hinder you and it's not a safe working space, we want or maybe it turns into a safe working space while you're there, and things have changed throughout time, is you have to let us know as well too. Protecting you is going to be so important. Making you look good and making us look good is going to be so important. You letting us know exactly what's going on in the home and the type of environments that you're in, whether it also too is it could be whether you are involved with physical, mental, or verbal abuse with your client. This could happen with dementia clients, and this is something that you need to report and let us know. We need to work it out and talk it out. Not all care professionals have the right expertise or experience with this, and it has to be approached the right way. And we're here to help you with that, right? And then last but not least is pet care. We can assist with help picking up any type of feces or help feeding the pets, no more than twice a day. Okay, so if there's anything more than twice a day, it's excessive. You need to let us know, but that's something that we can do. Okay, and this is part of the scope of care that we provide for all of our clients. We can assist with walking the pets clients as well too. But remember, if you're walking away and taking care of your client's pet, is your client a fall risk? Always remember that with everything you do, anything you do, when you go to the bathroom, when you're taking a break, when you're going to have a lunch break, is your client a fall risk? Are they at risk? That's another thing. If you're going to go and leave your client and you want to have lunch, make sure that you have total vision, eyesight over your client, okay? And that way that in case they were to get up or a little wobbly, you're there to catch them, to be there for them, okay? So that way it's a witness fall, all right? So it's important to understand that when you are leaving your client, that we're not just taking care of, anyone. It's the aging population, our clients, they need supervision. So if your client does need that at all times, be always conscious and think twice before leaving them, okay? You don't want to walk into a hot mess. You don't want to walk into your client laying on the floor with blood spilled all over the floor. It happens, okay? You don't want to be in that situation. You could prevent that, all right? So that's our scope of care guidelines here. And if you have any questions, you have any concerns, please call the office and let us know. And God bless you. Keep providing the beautiful care that you provide. Keep working with your heart. Always remember, and to whatever you have got going on before your work, set it away. Let it go. You have to concentrate on your client and provide them with the best care possible. And the scope of care that I just explained to you is all the type of care that we provide for our clients, and what we tell them when we do our assessment. So we back you up. So that way I make you look good and you make me look good too. when I go out and I shake family members' hands. So that way there's no misconception of what the type of care that we can provide. And that's why I have this video, is to make sure that you have a good understanding of what our mission is when you're there taking care of Affinity's clients. Take care, God bless, and we'll talk soon.